Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering more pharmacology, okay? I've gotten all of your messages, guys, so I'm going to make sure I push out more pharmacology for you. You already know I'm going to ask next. If you have not done so already, guys, please do not forget to like and subscribe below. Don't forget to share my content if you really love this channel and you'd like to support it. Guys, also, I'm on the other, well, not every other platform, but many other platforms such as, you know, TikTok, Instagram, Facebook. My handle's still the same, Nexus Nursing. If you'd like some additional resources to help you in your studies, you can check out my website, nexusnursinginstitute.com. Okay, guys, without any further ado, let's get started. First question. A nurse is preparing to administer a dose of warfarin to a patient. Based on the nurse's knowledge of this drug, the nurse knows to monitor for which of the following side effects: A, black stool, B, constipation, 3, abdominal bloating, or D, back pain. And guys, the correct answer is A, black stool. Why are we going to be concerned with black stools? Why are we going to be looking at that? Well, the reason for that, guys, is this patient's on Coumadin. We want to make sure that they're not bleeding, right? So we're going to be looking at that stool to make sure that there's no internal bleeding going on and the blood is coming through the stool. When the patient is on Coumadin, you need to be teaching the patient to make sure they're looking at their stools. When they're brushing their teeth, look at the when they spit out, make sure that it's not blood tinged. Check their body for bruising. Why? Because this patient is at risk for bleeding. So that's why A is the correct answer. Let me adjust my camera for you guys. Okay, there we go. Next question. Which of the following is considered a contraindication for the administration of Lasix? A, 4+ pitting edema in the lower extremities, B, hypertension, C, facial swelling, or D, decreased urine output. And guys, the correct answer is D, decreased urine output. Guys, whenever the kidneys are in trouble, you're going to see urine output go down, BUN and creatinine go up. So guys, why would you give a diuretic, why would you give a diuretic to a patient whose kidneys function is down? Does that make any sense? Absolutely not. You're not going to make the kidneys work harder, kidneys that are already weak for whatever reason. So you're not going to give a diuretic to a patient who has decreased urine output. And by the way, guys, urine output should be at least what? At least 30 cc's or mLs per hour. Now, choices 1, 2, and 3, those are indications for Lasix. Those are reasons why we would give a patient Lasix, okay? Next question. A patient requires a dose of an antiemetic medication which has been sent from the pharmacy in an ampule. Which of the following must the nurse consider when drawing up the medication from an ampule? Select all that applies. Guys, how do we treat select all that apply? As true or false? Let's go. A, tap the top of the ampule before opening. Absolutely. The reason you're going to, tap that top is all that medication that's in the neck of the ampule. You want to get it out so you can get the full amount of medication when you're drawing it up. Choice number 2, snap the neck of the ampule towards the body. False. How do we tap it? How do we snap it? Away from the body, not towards, away. So that's false. Choice 3, use a filter needle when drawing the medication from an ampule. Absolutely. Can you imagine if you did not use a filter needle, you just used a regular needle and you drew up all that medication with tiny shards of glass that's going into the patient's blood vessel, right? So you're going to want to use a filter needle to make sure that you don't get any pieces of glass into that syringe, right? And then after you drop your medication, you're going to get rid of that filter needle and put a regular standard needle, right? You're not going to inject the patient with a filter needle that you just caught all of what? That glass? No. So C is true. D, invert the ampule to drop the medication. Yes, absolutely. You're going to invert that ampule so all of the medication can be towards the bottom and any air bubbles do what? Float to the top. Choice E, use a filter needle when administering the medication to the patient. Absolutely not. After you've used that filter needle to grab all of the medication and make sure that you don't grab any of the glass, you're going to change out that filter needle and put a standard needle back onto the syringe so you can inject the patient. Next question. A nurse chooses the dorsogluteal site on a patient in which to administer an IM injection. Which of the following should the nurse consider when giving an injection in this location? A, the site's most appropriate for all clients. B, the dorsogluteal site is the safest and it doesn't contain major blood vessels. C, injecting the medication at the site may cause damage to the sciatic nerve. D, the site tends to cause most pain for the patient and is least appropriate. And guys, the correct answer is C. Injecting the medication at the site can cause damage to the sciatic nerve. And by the way, guys, if you cause that damage to that nerve, it's permanent. There is nothing that we can do. That patient's going to have to live with that pain for the rest of their lives. Okay, so let's look at our other choices. A, the site's most appropriate for clients of all ages. That's incorrect. That's just not true. We don't give it to pediatric patients because they haven't developed muscles in that site yet. Choice B, dorsogluteal site is safest because it doesn't contain major blood vessels. That's false. It's not the safest because obviously, you know, there's a chance of hitting that sciatic nerve, and it does contain some blood vessels, so that's false. And choice D, the site tends to cause the most pain. Guys, it's the IM. You're going to get pain regardless of where you give that injection. That's the wrong answer. C is our priority. We want to make sure that we do not hit that sciatic nerve. We don't cause sciatic damage because they will have damage for the rest of their lives. Okay, next question. A patient must receive a number of injections of medication based on his condition. Based on his medical condition. The nurse wants to reduce his discomfort however she's able. Which of the following interventions can the nurse perform to minimize the patient's discomfort from repeated injections? A, administer the injections in approximately the same area each time. B, apply EMLA cream after giving an injection. C, use the smallest gauge needle available. Or D, avoid administering any drug that could be irritating to the tissue. All right, guys, and the correct answer is C. Use the smallest gauge needle available. Guys, that will help to decrease the patient's discomfort. Now, let's look at the wrong answer choices. A, administer injections in approximately the same area each time. Absolutely not. What happens if you do that, guys, you're going to cause that tissue where you keep injecting in the same place every time. You're going to cause that tissue to harden, and then the absorption rate will be severely decreased, okay? 2, apply EMLA cream after giving an injection. No, you apply EMLA cream before you give the injection. What's it going to do for the patient if they already got the injection? They already felt the pain. That's wrong. D, avoid administering any drug that could be irritating to the tissue. Oh, we're playing doctor now. Is that what we're doing? We're deciding which medications we're going to give and which ones we aren't? Absolutely not. So, guys, the correct answer is choice C. Next question. A school nurse is offering tuberculosis testing for all of its employees. The health nurse administers injections to each of the employees using a tuberculin syringe. At which angle does the nurse administer the injections into the skin? A, 90 degrees, B, 60 degrees, C, 25 degrees, or D, 10 degrees? And guys, the correct answer is D, 10 degree. Remember, guys, this is an intradermal medication that we're giving. We're giving it right under the skin. So, you know where the patient's forearm is? Right under the skin. So that's why you want that 10-degree angle because, like I said, you're going right under the skin and you want to produce what? A wheel. You want to produce that little bubble, okay? So D is the correct answer. A process that moves solutes from an area of higher concentration to an area of lower concentration is known as A, active transport, 2, capillary reabsorption, 3, diffusion, or 4, filtration. I'm sorry, I said 1, 2, 3, 4. I meant A, B, C, or D. And guys, the correct answer is C, diffusion. So what happens, guys, when those solutes move from an area of higher concentration to an area of lower concentration, such as in the body, when those solutes move, guys, what happens is it causes an equalization of fluid. The fluid will move from the intracellular to the extracellular space. Next question. In which situation would a nurse need to apply an IV filter to a fluid administration set? Select all that applies. Guys, how do we treat select all that applies? As true or false? Let's go. A, for a patient with heart failure. False, not necessary. B, for an immunocompromised patient. True, very necessary. Why? Think about it. An IV filter, guys, that's what, catches small particles from going into the patient's vessel. If the patient's already immunocompromised, you think they can afford to have any particles into their blood vessels? Absolutely not. So yes, we're going to use that immunocompromised patient. C, when administering TPN, absolutely, guys. Remember, TPN, total parental nutrition. What's that middle word? Parental. If something's given parentally, that means it's bypassing the GI tract. Patient's getting TPN, it's going directly into that vessel, right? Absolutely, we want to keep small organisms, small particles from entering the vessel. So true. D, when administering blood products, false. And I know many of you guys are going to fall for it. Absolutely false. What kind of filter do we use for blood products? A microfilter, okay? Microfilter. And choice D, in pediatric patients, that's absolutely false. So the correct answer, guys, is B and C. Next question. Which of the following types of IV fluids is an example of hypertonic solution? A, half normal sodium chloride, B, lactate ringers, C, D10W, or D, normal saline? And guys, the correct answer is C, D10W. So what they're asking about hypertonic solutions, they're talking about solutions that have more solutes than the plasma does, okay, compared to plasma. And that is your D10W. Next question. In which situation would a nurse most likely use a pressure sleeve when administering IV fluids? A, the patient receiving antibiotics. B, the patient that needs rapid intravascular fluid repletion. C, patient who has high blood pressure. Or D, the patient who's obese. And guys, the correct answer is B, the patient that needs rapid intravascular fluid repletion. So guys, this pressure sleeve, this is something outside of the bag. And what it does, it pushes the IV fluid much faster. So we use this for a patient that needs fluids quickly. They need lots of fluids and very quickly, such as what? Your patient that's hemorrhaging to death, right? We need to go ahead and replace the fluids that are in the intravascular space. Who else? Patient who's severely dehydrated, patient who's gone through extensive amount of burns. Remember, burns causes what? Dehydration. It pushes fluid out of the vessels and into the tissues. So these type of patients that need fluids hard and fast, we may use that pressure sleeve, okay? Patient calls the nurse and complains about his IV site. The nurse assesses the site and notes that the skin is red and warm, and the patient states that pain travels up the arm. Which of the following potential complications of IV therapy most likely describes the situation? A, phlebitis, B, thrombus, C, infiltration, or D, circulatory overload. And guys, by the way, for those that are complaining about the gulping sounds when I swallow my coffee, I don't know what to tell you, because I spend my whole day, I'm either teaching or seeing patients, and I come home into my studio to make these videos for you. So guess what? My voice is parched, and I need to stay awake to make these videos for you. So I don't know what to tell you. That was 3 gulps, just in case you didn't hear it. Okay, guys, so the correct answer is A, phlebitis. Phlebitis is inflammation of the vessel, and we usually will see that right there at the IV site. Those are those signs and symptoms, guys. The skin that's red, warm, and the patient feeling pain traveling up that arm where that inflammation is noted. Let's look at our wrong answer choices. B, thrombus. Thrombus is a blood clot. C, infiltration. That's when the fluid that's supposed to be in the patient's vessels leak out into the tissue. And C, circulatory overload. That's when the patient gets too much volume of, blood or fluid, okay? So the patient will have signs and symptoms of like where, it's too much fluid, so the fluid has to go somewhere. You're gonna see distended jugular veins. You may start to see some edema. You may hear crackles in the lungs. That's when the fluid, it spills over to the lungs because it's gotta go somewhere. So anyway, for this question, guys, our correct answer is A, phlebitis. Patient who has a patient who takes digoxin has developed signs of toxicity, including nausea, vomiting, diarrhea, confusion, and cardiac arrhythmias. Once the nurse determines that toxicity is present, what is the first action the nurse should perform? A, discontinue the digitalis dose until symptoms are gone. B, check the patient's pulse before giving the next dose. C, administer the medication IV instead of orally. Or D, administer antiarrhythmic and drugs to prevent nausea along with the next dose. And guys, the correct answer is A, discontinue the digitalis dose until symptoms are gone. So guys, whenever you guys get a test question about a patient getting a medication and something's going wrong, the first thing you're going to do is discontinue the infusion of that medication. That is the first thing you're going to do before you do anything else. They gave us enough information. They even told us that we recognize that the patient's going through digitoxicity. So we're going to stop it. That's the first thing we're going to do. Then after we stop it, we're going to call the doctor and say, hey, I noticed the patient had XYZ. I stopped that medication. What do you want to do? And in cases of digitoxicity, we expect the doctor to order Digibind. Okay, that is the antidote for the digitoxicity. It will actually stop the absorption of dig. It will reverse those effects. Does digitoxicity reverse effects or just stop? I think it just stops the absorption. Not sure if it reversed effects. Guys, look that up. Go ahead and let me know in the comments. I can't recall off the top of my head. But anyway, for digitoxicity, you do expect Digibind to be ordered. All right. Wrong answer choice is B, check the patient's pulse before giving the next dose. So you recognize that the patient's going through digitoxicity. You're checking their pulse just to give them more of that medication. That makes no sense. Matter of fact, if this answer choice said just to check the pulse, it said nothing about giving the patient more, it still would be wrong. Why? Because in the body of the question, they gave us enough information to understand that the patient was going through digitoxicity. Look, it told us that the patient's having what? Cardiac arrhythmia. So what is the pulse going to tell us that we don't already know? Absolutely nothing. Choice C, administer the medication? Absolutely not. So you recognize the patient's going through digitoxicity. It can kill the patient, and you're going to go ahead and give them more of that medication. Are we killers? No, we're nurses. So that's wrong. Choice D, administer the antiarrhythmic and drugs to prevent nausea along with the next dose. Are you kidding me? Absolutely not. Yes, you may give arrhythmic drugs. Yes, you may give anti-nausea drugs, but you're only going to give them after you stop the medication and you call the doctor and you got those orders, right? And you're definitely not going to give more of the digoxin. All right, guys, next question. Patients getting ready to be dismissed from the hospital with several prescriptions for medications, including morphine by mouth. Which statement from the nurse should be included as part of the discharge teaching of this medication? A, you may experience more bowel movements or even diarrhea with this medication. B, you should not drink alcohol or take medications that make you feel drowsy while you're taking morphine. C, this type of medication may cause urinary tract infection, so don't be alarmed if that happens. Or D, you need to take another adjuvant medication with each dose to avoid substantial effects of the medication. And guys, the correct answer is B, you should not drink or alcohol or take medications that make you feel drowsy while you're taking morphine. Morphine is what? An opioid. It's a narcotic. It's already going to cause depression of the system. It can already cause drowsiness. The patient should not be taking anything else that can further cause drowsiness, guys. B is the correct answer. And you know, patients should never take alcohol with any drugs across the board. Next question. Which best describes how benzos work in the body? A, inhibiting neural impulses by blocking dopamine. B, blocking a reuptake of serotonin. C, increasing renal excretion norepinephrine. Or D, enhancing the effects of GABA by inhibiting its binding to receptors. And guys, the correct answer is D, enhancing the effects of GABA by stopping it from binding to the receptors. Guys, remember, GABA, that is what causes the sedative effects. That's what causes the patient to be less anxious. D is the correct answer, guys. It can also but help the patient to do what? Sleep. Now, wrong answer choice is A, inhibiting the neural impulses by blocking dopamine. Those are anti-dopamine drugs such as your Seroquel, and we see that in lots of antipsychotic medications such as the schizophrenic drugs. Where was I? B, blocking the reuptake of serotonin. Those are your SSRIs, such as, Prozac. And then C, increasing renal excretion of norepinephrine. On top of my head, I don't know any drugs that increase the renal excretion of epinephrine, but I do know drugs that, will block the effects of epinephrine, like your beta blockers, right? So, the correct answer for this, guys, is D, because like I said, more of the GABA that you have, the more it decreases. It brings that sedative effect to the patient. Which of the following is a true statement regarding prescription and administration of Schedule 1 substances? A, Schedule 1 substances should be prescribed only through a written order. B, Schedule 1 drugs cannot be renewed after 12 months of use. C, Schedule 1 medications require 2 persons to sign off on the prescription. Or D, Schedule 1 drugs have no accepted medical use. And guys, the correct answer is D, Schedule 1 drugs have no accepted medical use. I'm talking about crack, cocaine, heroin, LSD. There is no medical reason for these drugs to be taken. So they are approved for no use at all, okay? And we're down to our last question. After administering a liquid opioid analgesic to a patient, the nurse must waste 3 mLs. Which of the following action is most appropriate when wasting this type of medication or this type of controlled substance? A, pour the medication to biohazard bag. B, throw the bottle into the trash. C, pour the extra medication down the sink. Or D, place the excess in a sealed container and lock it in the medication cabinet. And guys, the correct answer is C, pour the extra medication down the sink. You can do it down the sink or even flush it. Why? The point is you have to get rid of that drug in a way that it cannot be retrieved. You can't go back later and get it, or somebody else can't go back later and get it. So when you're wasting this medication, you want to waste it in a way that it cannot be retrieved, and you want to do it with a witness, so you're going to have another nurse present. That's why C is the correct answer and not A, B, or D. So guys, I hope you found this video to be helpful. If you want to see more pharmacology, please let me know in the comments. If there's anything else that you'd like to see more of, please go ahead and let me know in the comments. I think I've pretty much covered every single topic in nursing, but you can never have enough. So just let me know in the comments if there's something that you'd like to see more of. Guys, don't forget my tumblers for sale on my website. Also on my website are additional resources, nexusnursinginstitute.com. Check me out up on my other social media platforms, Facebook, Instagram, TikTok. And guys, thank you so much for the support. I've gotten so many emails and comments of you guys telling me that you've passed your boards, and thank you guys. The best way to support my channel is by sharing my content. Please help my channel grow. Share my content across your social media platforms, and you'll be seeing me next week.